instructions for Shrine Drivers for the Mary Free Bed Hospital in Grand Rapids for dropping patients and families off, where to park, etc. For those drivers that are not familiar with Grand Rapids, the easiest way to get to Mary Free Bed is take the Wealthy Street exit off from US 131, just a little bit south of downtown. Go straight ahead. You're going east now on Wealthy, just past the roundabout, and when you see the roundabout, you'll see Mary Free Bed over there on the left, and that's where we will be dropping the families and the patients off. I'll show you up here where we go. There's the sign on the left, Mary Free Bed Hospital, just past the roundabout, and we turn into the hospital to the left. Pretty easy to see. You'll see the sign up there under the covered area that says main entrance. That's where we pull up, drop off our patients and family, and they go inside the door. There'll be a greeter inside the door to check in and give them further instructions. Then we'll continue on around after we drop the patients off here. If the patients are not coming in a Shrine van, they have valet parking here as well. And then we go up here on the left and park in the flat lot with the Shrine van. Here's just flat parking, and any spot that's available is okay for us to park in. Our drivers will pull in right here off of Wealthy Street.
Correct.
Pull right in up here to the drop-off area, and then the patient and the family will come in this way, and the greeter will take care of them from there through the registration process.
Absolutely. So you'll check in with the greeter, Karen or whoever we have. Our greeters are amazing, and then they will take you over to registration. All right, my name's Eric Miller. I am the marketing manager and videographer for Mary Free Bed Rehabilitation Hospital in Grand Rapids, Michigan. Here with Tom, we're going to do a tour to let you and your patients know how to come into Mary Free Bed, where to park, and then how to get your patients where they need to be. So,
Hi.
How are you?
Good, thank you.
Good.
So can you explain what's going to happen then when our driver comes with the patient, and what's the process?
Yeah, so they'll come right into the main doors here, and then I most likely will greet them and ask them where they are going or what kind of an appointment they have today. With your group, I would just tell them to come on in and have them get checked in with one of our registration bays. And then when they were done getting checked in, I would have them sit over in our library area or Big B area, over on that side, because they'll be coming out of that door with a C on it to get them. Mm-hmm. Okay, so our green lights are on, so that means that we can head on in there, that the bay is open for us to go in and register.
okay, so Tom, we've just checked in the registration, and now this is the seating area where you can wait until Kelly or another clinician comes and brings you back. So nice area. We have a Big B coffee right here if you're in the mood for a coffee, and then this is our waiting area right next to where you need to be. So
tell us a little bit, Eric, about this video behind us here.
we have a number of digital signage screens, and we use them because we produce a lot of video, patient stories, events. This particular video right here is when the grand opening of the Mary Free Bed YMCA a couple of years ago, which is amazing because it's a universally designed YMCA, the first in the planet. There are no steps, everybody can access everything in the hospital, able-bodied, or if you happen to use a chair.
I have been to it.
It's pretty amazing.
Very nice.
So yeah, so you get to watch some amazing Mary Free Bed content as you wait.
Great.
All right. And this is Big B Coffee, where you can have a coffee while you wait for your patient. As a driver, wait for your patient to get the care they need. So we're going to pick this up as we've already checked in, and we're coming through. Let's take you to a patient room. I'll let you gentlemen go right in through here. All right, Tom, this is a very good example of what a room will be like when the patients interact with the doctors wherever they may be through this unit. This will be able to teleconference the family, the patient with the doctor on the other end. We also use this hallway outside. It's a really cool thing that this camera can actually, and this unit can travel with the patient so that the doctor on the other end can actually walk with the patient to see how the gait is. So
that's helpful.
Nice and nifty little device.
So there may be some x-rays or MRIs done as well, and the doctor will have access to those through the teleconference, and they can actually pretty near examine a patient right here on the table with the cameras and things.
That's absolutely right.
Very helpful, saving us lots of unnecessary trips to Cincinnati and Chicago, and you've already done several of them for Cincinnati and the Chicago hospital.
All right. Everything good? You have any pain or problems getting around? No. But no hip pain or anything during your activities? No. All right, let's have you stand for me.
The benefit of doing this, we don't have to take a whole day off work. We don't have to travel. I mean, just the distance. I mean, driving. We actually missed our last appointment because, I mean, it just wasn't convenient. Like, it wasn't lining up with time, and it just, yeah. So this is a lot more convenient.
Thank you so much.
Thank you for taking your time this morning and showing us a little bit about the teleconferencing system at Mary Free Bed Hospital.
Our pleasure.
Thank you.